Hi loves, welcome to 24 Telemed, Anambra State e-health services powered by 24 Telemed. So in today's video, I want to be talking about hypertension, or as a lot of people would like to call it, high blood pressure. Statistics shows that hypertension affects 50 million people in the United States and approximately 1 billion people in the whole world, right? So hypertension is a big deal. Most adults that are up to 50 years and above usually have a risk factor of hypertension, and the problem with hypertension is that it could lead to a lot of heart diseases, but the good thing is that it can be controlled. So if you want to define hypertension, you could say that it's the persistent increase in arterial blood pressure. You talk about the systolic and the diastolic blood pressure of equal to or greater than 140/90 in adults more than 18 years of age. It's obviously important that it's either you own a blood pressure monitor or you always go to a primary healthcare center and get your blood pressure monitored, and anytime your blood pressure is greater than or equal to 140/90 arterial blood pressure, systolic over diastolic 140/90, and it is consistent like that for 3 consecutive days, right? It's possible that you have hypertension. What are you going to do? Of course, you have to call your access care doctor. Yeah, my lovely friends, in 90% of the population of people that have hypertension, the real causes or the risk factors of their hypertension is usually unknown. You can say idiopathic hypertension. However, in 10% of population, there are still some primary risk factors associated with hypertension. Some of these risk factors involves age, obesity, cigarette smoking, physical inactivity, dyslipidemia, diabetes mellitus, family history, stress, and salt intake. These ones are the primary risk factors associated with hypertension. There are also other risk factors, secondary risk factors, but I would rather dwell on the primary risk factors because that one is the one that for most part you can actually control. In the treatment of hypertension, my lovely friends, the main goal of the therapy is to reduce the systolic and the diastolic blood pressure to less than 140/90. For most part, if you are able to reduce the systolic blood pressure, then the diastolic blood pressure will usually follow suit. It's usually easier to control it. Also, there are patient focused intervention, the one that you should do for yourself. For most part, patients that have hypertension, it is usually asymptomatic, so for most part you will not be feeling symptoms. However, you should understand that hypertensive drugs are lifelong drugs. You should take your medications every day, and you should keep checking on your access care doctors from time to time. You should continue going to your primary health care centers for you to be checking your blood pressure, right? For you to be checking your blood pressure and be knowing your figures, you must always know your figures, and then you should always check back to your doctors. And that is exactly where access care comes in. You should not be doing it alone, right? Because the medications are lifelong. It is something you would take to control your blood pressure for the rest of your life. Also, weight reduction and aerobic exercises. As you know, one of the risk factors associated with hypertension is obesity. So anytime you see yourself obese and you're hypertensive, the next thing you should do, apart from taking your medications and knowing your figures, is always to try and be in a good weight index with regards to your body mass index. Your body mass index is usually supposed to be less than 30. Anytime your body mass index is more than 30 kilogram per meter square, right, you should try and reduce your weight, and then you should involve yourself with aerobic exercises that will make your heart rate to increase. Such exercises will help blood to circulate nicely all over your body. The next one is salt reduction. Sodium. Try as much as possible to stay very far away from sodium and salt. If you are able to stay away from salt, chances of decreasing your blood pressure is almost by 60% by doing only salt reduction or salt removal or sodium reduction. It's not as if you don't need sodium, but naturally you will get sodium in almost everything, including milk, including Milo, including seasoning cubes, including all those beautiful canned juices, drinks, all of them, most of the time they contain sodium, they contain salt. So if you stay away from all of those kind of things, you are going to be reducing your hypertension by 60%. There is something we like to call DASH diet, dietary approach to stopping hypertension. My lovely friends, studies have shown that eating food rich in fruits and vegetables, it could increase the potassium level in your body and offset the sodium level in your body and act on the kidney to reduce the blood pressure eventually. It is advised that cigarette smoking, potassium smoking and alcohol also elevates blood pressure. There are drug-focused intervention for hypertension. There is the low-dose thiazide, there is the alpha and the beta adrenal receptor blockers, there are angiotensin converting enzyme inhibitors, there are calcium channel blockers. But here, my lovely friends, I am not going to bore your heart and your mind with all these drugs. That is exactly why you need an access care doctor, a doctor you can easily call on phone to complain to tell what your blood pressure is and to tell the drugs you're using. Remember, hypertensive drugs are lifelong, something that you have to take for the rest of your life. It's not if your blood pressure reduces, you stop taking it. It's not if it increases, you double the dose. It is something that if it is increasing, you tell your doctor what is happening. If it is reducing, you tell your doctor what is happening. So at every point in time, you will need to be calling a doctor and you need to be telling the doctor specific drugs you're taking and even their side effects. Remember, every drug have side effects. For instance, people that are taking drugs like lisinopril, captopril, enalapril, people like that, especially those of them that are smoking, usually have dry cough. So if you start coughing, if you start having dry cough, instead of you to run and go and take cough syrups and then the cough will continue and then you now go and take something like Ceftrin and I don't want to keep mentioning names of drugs so that you not run and go and buy those drugs and start abusing antibiotics. It's not going to be good for you. You understand that it's a side effect of treatment of some hypertensive drugs. So don't wish. It's not something you just wish like that. Go to a pharmacy and then tell the person that to give you antibiotics or to give you a different kind of drug. You need to talk to your doctor. There are project managers' numbers that I'm going to leave in the description box of this particular video. Please don't do it alone. We are here to help you. That is why there is telemedicine. You can stay from the comfort of your home, call a doctor even in the midnight and let the doctor help you. Oh, that is why we are here. Yeah, my lovely friends, this is where this video is going to be ending. Please let access care doctors be your friend. You can call us from the comfort of your home anytime, any day. It's easy. You make your life easier. Until next time, love and light. Bye.